Hello, hello, hello. Kenya, welcome to the Every March Network. We are all about the 5 E's: etiquette, expose, entertain, evangelize, empower, and elevate. I am your friend, your sister, and your girl, Evelyn Marsh.
Much.
Hello, hello, hello.
Refuge in you and you alone. You're the beginning and the end, creator of everything. Without you there won't be anything. Alpha and Omega, the great I am. When I'm down and know I'm not alone, you hold me close through every trial. Lord, you never leave. You gave us peace and harmony, blessings for eternity. My fortress.
Hello, 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 everyone. Welcome to the Evelyn Marsh Network. We are excited to be here. Though we we had a technical problem just now. We were on, and then the internet started tripping, and so we had to log out and log back on. But we had to wait a little bit. Hopefully that's not going to happen. But we are happy to be here. Our guests, yeah, they are in the back in the green room waiting. But for now, I want to say happy Sunday. If you are celebrating your birthday or your anniversary, want to say happy birthday to you. If you're celebrating it today or last week and this week, happy birthday and happy anniversary. Happy Sunday to everyone. We hope you had a wonderful time in service today. And we pray that God will bless our going out and our coming in this week as we go through the week. We pray for his protection. Again, welcome to the Evelyn Marsh Network. I'm going to bring on my personal handbag and my pujupu, my co-host and my 2A. She's gonna come on here right now.
Hello, everyone. Welcome again to the Evelyn Marsh Network, where we bring you educational topic, juicy, hot topic. Today again we have a very good one, interesting one, and it's all educational.
Yeah.
Again, we are here to discuss about our mental health. And please tune in. Audience, when you do log in, please, just say hi or something so I can take your name down, because again, remember, we are here and we are bringing in these topics for you to weigh in your suggestions, your comments, so we all can learn something from it as well. And keep in mind, again, we are also going into a raffle draw for our consistent listener. Something great is coming out there for you guys. So keep coming in with your comments. Keep bringing in those suggestions and what we can do to improve our platform as well. Again, follow us on LinkedIn, on Facebook, Twitter, Instagram,
YouTube.
Snapchat, everywhere that you can find us, every digital platform, we are on there. And this is also gonna be, oh, great news. We are coming out with that one. The Evelyn Marsh has now partnered with Success Radio Station in Liberia, which this will also be air all week long. So it's not just in America here. It is not just in Europe or wherever, but it is also going to be aired live on radio as well in Liberia. And it's going to be all week long, bringing education to everyone, so we are not just limiting ourselves here. So kudos to the Evelyn Marsh Network. Thank you all. Again, be blessed. Enjoy the topic. Don't forget to comment. I need your name. Please comment. Thank you. Andrea, thank you very much.
Okay,
Thank
so
you for
let
coming.
me add let me add to that. Again, we want to welcome you to the Evelyn Marsh Network. Please comment. We would not know if you are here if you don't comment. So many times I've heard people, oh, I was on there. Did you comment? Well, I didn't announce your name because you didn't comment. So please comment so we can welcome you and appreciate you for being here. And so we can also know that you are here. To add to that, yes, we are in partnership with the Success FM and TV network or radio in Liberia 100.9. So I want to encourage you to also, they are also on Facebook. So please like and comment there on the page as well. Please follow them. We are going to be in Liberia from Monday. Hold on one second. Monday 9:30, every Mondays 9:30 p.m. to 10:30 p.m. Monday to Saturday. So we are not only here like she said, but we are also in Liberia as well. So whatever we air here, starting from tomorrow all the way to Saturday, the Every March Network going to be on in Liberia as well. So want to give God the praise for that opportunity. And we know for sure we have more to come. So now we will go straight into, do you want to welcome them quickly? Could you put so I can, before we bring on our guests, please, if we have anybody on.
All right. Tonight we have a CEO on here from the Favor Grace Wellness Clinic.
Okay.
And we also have a doctor in how you call that, psychiatry or psychology. The man has so many degrees and things, but I ain't gonna go into all of that. So we have the CEO and the doctor that is working hand in hand with the CEO. So we have both people here from the clinic, and we are gonna be learning from them when it comes down to mental health. So I welcome my B sis, Favor Grace, and also this is Favor Grace, and I will also bring on Dr. James Fisk. Welcome, guys. Welcome. We want to welcome you again to the Evelyn Marsh Network, and we hope that you will enjoy here and educate us. Thank you.
Okay, so welcome. Will you please introduce yourself? We'll start with Favor Grace, and then we'll go to Dr. James.
Hi everyone, my name is Favor Grace Namwe, CEO and owner of Favor Grace Wellness Clinic. I'm a registered nurse, BSN. It's a pleasure being here.
Dr. James?
Yeah, I just want to say hi to everyone out there in listening and viewing land, especially for those in Liberia. I just want to say kudos to the Evelyn Marsh program. My name is Dr. James T. Fisk. I'm something called DNP, that's Doctor of Nursing Practice. I've played this role for the last 5 years, seeing a number of patients, something called across the lifespan. So, in other words, I work with kids who have mental challenges. I work with adolescents who have mental challenges. I work with adults who have mental challenges. I work with the elderly who have mental challenges. And it has been an interesting road in the sense that people walk through your door highly psychologically dysfunctional. And then just because you've been able to apply a combination of medication and advice for them to seek psychosocial intervention, you see that person returning to a less dysphoric kind of situation and can be a successful person within society. So it has been Herculean, but it has also been rewarding. Thank you for inviting us once more to share some of these experiences.
Okay. So once more, I see Andrea has commented, and Andrea, again, we want to say welcome. If you are here, I see a couple of you on, but you have to comment so we can know that you are here. I want to say thank you for staying in there with us. We had a little issue with the network, but we are happy to be on because this is a very important topic, and it will have really hurt us if we were not going to be able to. So we want to bless God. We were able to come back on. So if you left, please come back. We want you back. This is very important, and we want you to ask your questions, leave your comments, and what have you. So I'm going to start with Favor. The Favor Grace, is it together or?
Yes, together.
Wow, what a wonderful name. Okay, so we was, I thought it was separate.
All the blessing.
All in one.
I thought it was Favor and then Grace, but I didn't know it was together. Okay, so please tell us, what do you do? And then also, what is mental well-being?
Well, like I stated earlier, I'm a registered nurse. I've been in the healthcare field for over 10 years, going on 14 years. I've worked in every sector. Everything about healthcare, I work in it. And what stood out to me, mental health, because mental health is the whole being. As a person, if you're not stable mentally, you cannot function. So having said that, it drew me very closer to that to look into it more. So stating what mental health, mental well-being is, it's a whole package. It's composed of your emotional balance, how you live your life. You have to be mentally stable, mentally fit to be able to live a fulfilling life. If you're having issues with that, you cannot function emotionally, whether emotionally, physically, whatever the case may be. You won't be able to work. You won't be able to tend to family needs, or even about you. You will just be like out because mentally you are not stable. So your mental well-being composes of everything in one, whether emotions, physical, I mean everything spiritual, everything, because once your well-being is not set, you cannot function as a person. You cannot live a fulfilling life. So it's very, very important for us to focus on our mental health in order to live a fulfilling life. That's what drew me mostly to mental health. I kept delving into it and I was like, maybe I should do something more. And God led me to this. So
Okay, thank you, Dr. James. What caught my attention when you were talking about yourself? You mentioned children, and that's my field. I'm passionate, very, very passionate about children. And so, how do you know when a child has a mental issue? How do you tell? Because they are vulnerable. They don't say much, or they may not be able to explain what they are going through. So, how do you tell?
Right, that's an interesting question. Just because whenever you, whenever there's a reason for a patient, that can be a child or that can be an elder or anyone. Whenever there's a reason for them to be taken to or for them to seek uh, mental health treatment, it is because um, something called psychosocial conditions um,
Right.
are have become overwhelmingly challenging for a person, and because of that, you see an inability to cope. Okay, and the reason for that is simple. It you know perhaps you see a child screaming, crying, so and so. We're not talking babies now, just because babies have their own manifestations. So we're looking at a minimum 3 years old and above, because at least that's when you would start um, looking at the possibility of a diagnosis of attention deficit hyperactive disorder. Okay, but what is happening behind the scene is where you have the most importance. Um, and that speaks to the issue of stigma, just because people see these things happening, and then it becomes difficult to have those conversations. But what is important to understand is that the brain, there are activities of communication in the brain. Okay, and the activities of communication are carried out through something called neurotransmitters. And you have different types of neurotransmitters. Okay, monoamines, amino acids, peptides, and uh, acetylcholine, stuff like that. Okay, now if you have a dysfunction in that, you have certain kinds of manifestations that we who are trained, we see and we know. So take for instance, if you have a child that's consistently secluding themselves from others, if you have a child that's consistently being aggressive towards others, if you have a child that is manifesting adult type behaviors that are inconsistent with their age, once you begin to see all of those things, for someone like us who are trained, we know there and then there may be some mental issues. Like a child be like, oh, well, I think I want to hurt myself, or a child who's banging the head, which is a manifestation of something called autism. Okay. And
Mhm.
there's a word that goes along with it. It's called stymie. So it's kind of deep. Okay. But just to answer your question at the broader level, we'll be looking for uh, dysfunction, dysfunction in speech, dysfunction in presentation in terms of interaction and the rest of it. So all of these things, those are things we look at even before the parents speak. Okay, is a child having auditory visual hallucination? Is like as if to say uh, uh, responding to something called internal stimuli. Are these things happening? So these are all the different kinds of manifestations we look at and be like, okay, there's a possibility, and there should be some kind of intervention, whether it's medication or whether psychosocial intervention. That is another level of determination that has to be made.
But you know,
Wow.
I see you doing. So I think my co-host. Before then, before you ask your question, or say something, please welcome. There are some people here.
Yes,
And
I
what
do see
welcome
them.
and
I see Andrea, man. Andrea, I'm gonna give it to you today.
course right
Yes,
on
we
time.
have it.
Welcome. Welcome, Andrea. I don't know where you're watching from, but thank you for coming through. So we have also um Miss Kona Hayes is on here watching.
Oh,
Mara, and we have Nana Otu.
yeah,
Welcome, sis Emma also is watching.
awesome.
Welcome, sis. Thank you for tuning in. This is another one. You guys open it up, so welcome and thank you again.
Okay,
Woo.
go ahead. I heard you.
Listening to the doctor, man. The man talking, he's talking. My head is just, we were asking.
Hold on, sweetheart. Hold on. I'm sorry.
Oh,
Um,
please
I
flow
don't
more.
want to lose this. We
Mhm.
have some people here, so before they leave, they might stick to the end. But before they leave, I want to make sure they get this information. So we want to say thank you to the Success FM
Yep.
TV, 100. Hold on though. I got to make sure I'm saying the right thing with the people stuff so I can mess it up. But we are in partnership with the Success FM TV in Liberia, and they are going to be relaying our podcast from Monday to yes. So it's Success FM TV 100.9 from Monday 9:30 p.m. till Saturdays 10:30 p.m. So we are not only here, we are also in Liberia, and that's a great thing for us because we want our people in Liberia to also benefit from all of the good stuff we are learning here. And not everybody have the data and all that kind of stuff back home to come on and watch. And in fact, the time we come on is a little late. So we are happy that we could that Success FM TV could accept to partner with us. And we are so grateful. We don't take it lightly. So thank you, thank you, thank you again. Please go ahead, Trinetta. I hope you didn't lose your touch, but I didn't. Yeah.
I think no. So listening to the doctor explaining, especially when it comes down to the line of kids, because many of us as parents, we encounter that a lot with our children, but we don't know exactly what is going on. And the fact that he's actually breaking these things down so we can know and take note of our children as well. It just I was just going because there's so many things, and the fact that he talked about the attention deficits and stuff. So my question here to you, Dr. Fitz, is there a specific testing that you do with the children when it comes to seek for that mental, counseling or mental uh, uh, wellness or health? I don't know how to put it right now, but is there a testing that you guys do? Because I hear you speaking about the brain and what is going on, and the fact that they withdraw some at some point, and then they carry on adult behavior. Is there a testing that you guys do to determine what is actually going on before you can actually diagnose these children with whatever diagnosis they may have?
Yeah, sure. There are a number of tests. Uh, you have the Corners test, you have the Vanderbilt test. These are tests that were administered in the past to establish attention deficit hyperactive disorder. When Favor reached out to me as the CEO and expressed the desire to establish a clinic that would cater to the larger community, but especially to the African community, which is one of the reasons why I was happy to do so. Just because, to answer your question directly and then to speak to the issue, so you have Corners Vanderbilt, but then you also have something called neuropsych testing. Just because in the past, Corners and Vanderbilt would be more targeted towards attention deficit hyperactive disorder, but then you have uh, neurological dysfunction as well. In other words, if a child has a problem that may have developed uh, in utero, in other words, while the mother was pregnant, okay, but also as a result of some genetic, something called genetic polymorphism, okay, if it may have developed because of that. Another way that you would get to establish these things is something called through a neuropsych exam. Okay, so a neuropsych exam is yet another more sophisticated exam that helps to establish whether not just only ADHD, but it goes beyond that to look at autism and some other different kinds of stuff. Okay, and then linking that up with the Favor Grace Wellness Clinic, what is happening in that instance is that we now have an opportunity to avail these services to our people in a way that is more empathetic, more understanding, because of the cultural differences and the rest of it, it will be a little difficult uh, to provide such explanation because of the barrier, cultural barriers and stuff like that. Providing that explanation would be kind of difficult for a typical African person. So she was like, "Let's have a clinic," and I'm like, "Sure, I will avail myself for such services." Mind you, other than being having a doctorate, I also in the past worked as a elementary, junior, and high school teacher, as well as a college lecturer as well. And then also work in a number of other capacities I have for masters in communication. So I think I'm in a better position other than a therapeutic communication, but having a more uh, bringing that therapeutic communication into a clinical discussion with patients in a way that provides them with the ease and make them to understand that I know where they are coming from and to provide the opportunity to give them the kind of services that they seek. So long story short, yes, we do have a number of ways of determining other than something called DSM-5, that's diagnostic and statistical manual, which is what physicians and people like myself use to come up with these diagnoses. But in addition to that, we have neuropsych exam, we have Vanderbilt, we have Corners, and some additional tests.
Hmm.
You must be learning medical terms.
Yeah, they put on my head right now. I'm confused.
But I see Grace Flomo colleagues on here. Grace, thanks for
Yes,
being here. That's my son, Mama. Thanks for being on here. Co-host, do you want to read some comments
yes.
before we ask the next question, please?
Okay. So Andrea, you hear a lot, so I will see. She said we here. You welcome, Sugar. I don't know who the Sugar on here, but we're looking for the tea. And she's also encouraging everyone. If you're joining, please don't forget to share the live and invite someone so we all can learn together. My wonderful family. Okay, Brother James, I believe she is talking to you here. If you know someone we had not correct,
Who
we
here
had not
not correct?
correct,
Go
please
ahead, not
contact,
correct.
please contact Dr. Fix. Okay, we know that. Says Nana, say hello.
I don't know.
Um, Mother said, good job, my darling. Welcome and please share the live. Welcome, Emma. See my family doctor, so knowledgeable. Amen. Great work in the explanation. You know, drop big bomb.
Yeah.
Host, I hope yesterday because my brother ain't playing. I tell you, man.
Okay.
This Grace said, good job, family. Sis Kona said, thanks, Dr. James, for the explanation. That was very good for us to know as well. Dealing with it in the family ain't no beans. That real koto in the ah. She said, that you, when you say thanks for joining, I say welcome, sugar. Oh, okay. Thank you, Mama. Our all-time favorite is on here, Sis Kathleen.
Hey, our
Welcome again.
favorite businesses on here.
Welcome. Please tune in. Weigh in your opinion, your questions. We are here to learn. Sis Grace say I'm learning a lot. Yes, so
Yes.
especially on that line of children. I know my mom in a hot seat right now, or hot going like they when it come down to her children.
Mm. And you know what? I and thanks, Andrea, for encouraging people to share, like. But look, it's an awesome topic tonight again. So bring your mama, bring your papa, your grandmama, your granddaddy, your pots, your spoons, your pen, your dogs, your cats. We all are here to learn and grow together. Don't leave them behind. Bring the kids too. If Dr. James is speaking any English that they don't understand, he will break it down for them into parts so they can understand it. So bring everybody and let us learn tonight and grow together. This is very, 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 very important. I will give my co-host a chance to ask another question. If she have.
Okay. So the question here, I know Favor gave a little bit of explanation on why she decided for that. So my question here is, are there differences between mental health, mental illness, and mental well-being?
Let me sit
In
down for the one.
mental health, mental illness, and well-being. Yes, mental health is your whole self. Let's put it that way. It composed of your emotions, like I said, balancing your life, living a satisfactory life, that you'll be satisfied with your life. Mental health. This is something that can be diagnosed by like people like Dr. Fix. You have to go in to see a provider who's trained in that area, and that you get diagnosed and be treated with medications or whatever, psychotherapy, whatever treatment that they have to be able to help you stay in these treatment mostly are it's like lifetime. You gotta continue taking these medications, doing what the provider asks you to do in order to stay healthy. Mental illness and mental health, it's the same. It's the same thing. Because if you are seeing a doctor, they're gonna diagnose you with, let's say for instance, they will tell you that they diagnose you with bipolar disorder. So that's the illness. And then they're going to prescribe medications, therapy. You're going to keep doing follow up for that. So they kind of intertwine. Yeah, those are the
So,
three.
so before my co-host read a question here from Andrea, she said she have a question for Factor Fix. So, Uncle Matt, welcome. Matt Fly is here.
Yep, I got him.
Yeah, he's here tonight. And I
Yep.
think he's ready. So, welcome. We happy to have you. But so I will let her ask the question that Andrea have because I wanted to ask a question about my children. But go ahead without question.
She
Yeah,
is very passionate when it comes down to children because she deals with them. So Andrea, question here to Dr. Fix. She said, "Why is it so hard for family to admit that a loved one needs mental health intervention, especially in the African community?" That's true.
Well, that's a wonderful question because it's something I wanted to speak to. Just because as you were reading the comment, someone said something like to the effect that if your head not straight, you know,
She
you
says
can
so.
seek help. So let me say it this way, which is how I provide psychoeducation to most of my patients when I see them. Um, the chest can get problem. There's medication for chest problem. Stomach can get problem, running stomach, so on and so forth. There's medication for that. You can have a headache. You get aspirin. You take aspirin. Okay. You can have or swollen legs and so on and so forth, bilateral, or perhaps maybe one leg that's swollen versus the other. There's medication for that. You can have diabetes. There's pancreatic abnormality. You can have medication for that. You can have medication. You can have medication to address liver concerns. You can have medication to address kidney concerns. Now, these are all functional areas of your body. Okay, the central nervous system is not something spiritual. It's something that's physical. Okay, and the central nervous system has different structures and organs as well. Different structures, not organs, different structures. Okay. And like I mentioned previously, it has there are means of communication within the central nervous system and so on and so forth. So if you have dysfunction at the structural level or at the level of the means of communication, which is the neurotransmitters that I mentioned, you will be sick. Okay. But that sickness is not a chest sickness, it's not a liver sickness, it's a head sickness. Okay. Now, because people don't understand it that way, uh, the manner in which they have constructed the means by which they understand that abnormality within the brain is what has brought about the stigma. So, take for instance, something this simple as having a relationship for a long time. You had a partner, and then maybe the partner cheated on you. Okay. Now, what's going to happen is going to throw you into a deep depression.
Yeah.
Okay. Sometimes the depression is so deep you find it difficult to even wake up from bed. You can't eat, you can't sleep, you, you just want to just lie down. Okay. For days in, days out. Worst case scenario, people go to the extent of committing suicide. Okay. Now the reason for that is because by the time you have that level of negative exposure, you, the communication activities in the brain are significantly diminished. You have a neurotransmitter in the brain, it's called serotonin. Okay. Whenever you have that incident that has happened, you have a significant reduction of the serotonin level. When the patient comes to me and the patient is showing signs and symptoms of depression, what I'm seeing with my clinical eye is a patient who has a half full brain level of serotonin. Okay. So what I'm thinking about is a medication, just the same way how you go to a physical physician and they are thinking about a medication to give you to help to calm down your headache. I'm thinking of a medication that I'm going to give you that's going to restore your serotonin level. Because once your serotonin level is restored, that stuff I was supposed to make you so depressed and get you lying down all day, all of a sudden you don't have to lie down. Now your partner becomes confused because they expected that you'll be all wrapped up in the bed and crying and the rest of it, but you're not doing any of that stuff. Because why? Just the same way how headache can get treated if you have problems because you have a neurological assault because of social situations. You can also have restoration through the medications that can be prescribed. Okay. Now that's one area. Okay. Let's look at it from another standpoint where we come from, right? You say, get private churches in Liberia.
I enjoy. I was going to ask that question. Like, who you went there?
So you go, right? The poor say the prophesy on you, right? The reason why they are able to prophesy on you because they see spirits, they see angels, and so on and so forth that tell them stuff that more or less come to happen. Now, there can be some biblical disputes as to whether they are seeing angels or demons and so on and so forth. Within a Western paradigm, if you came to a Western provider and said that, you saw something and it was telling you that this thing was going to happen in the future, so on and so forth, they would be diagnosing you with schizophrenia, okay, or psychosis, okay. But if you came to me, given a cultural context within which you would be speaking, the first thing from me would not be that, oh, well, the person has psychosis. You see what I'm saying? So in other words, for someone like me, it's easier to eliminate what would otherwise be seen as a stigma and be seen as a reason for someone to not walk over and be like, okay, fine. This is what is happening. And is there a possibility, okay, that I may need help in this direction? Now, lastly, people talk about dementia. Okay. Dementia is something that has become accepted. And if you notice, there are no stigma attached to dementia because people understand that with time, people lose the ability to remember stuff. Okay. Now, the reason why that is happening structurally is that there is a diminished level of a neuroreceptor in the brain called acetylcholine. Okay. So there are medications that you would take that can restore your serotonin level, and then you have the capacity to remember more than you did in the past. You see, but with that, there's no stigma. So the better people understand that the brain, like other parts of the body, can also be ill and needs to be treated, the sooner people get to understand that, with time, this whole issue of it being stigmatized into, when you're here not straight, kind of stuff like that, kind of tend to go away because it will be like anxiety. Okay, people worry about the fact that they don't have a future. They wake up in the morning, there's no job. Okay, so then people start doing something called self-medication. In other words, using substances because you're thinking about your family. You can't there's no job to feed your children the next morning. So you're not sleeping all night. The fact that you're not sleeping all night, you have something called REM dysfunction, rapid eye movement sleep. In the absence of that, you are significantly affecting your limbic system in the brain. How do you resolve that? Medication. So once people understand the universe of all of these complexities, they get to realize that so they think almost is also like getting heart attack, or it's also like getting high cholesterol, so on and so forth. So are we trying to demystify it at the Favor Grace Clinic? And I'm hoping, just because this thing is going to be broadcast in Liberia, that people understand that there are psychosocial circumstances that kind of diminish people neurotransmitters, and there are in utero activities that can lead to structural brain abnormalities. All of these things help to create those conditions that we call psychiatric reasons for people to seek treatment.
Jonathan, lost.
Want to recruit you. Andrea is doing a very great job in the comment
Andrea,
section.
please, continue sharing in life.
Welcoming everybody.
Andrea, say my job here.
Not lost.
I'm gonna recruit. I'll
this.
excuse me, without asking the team to do something else. So, I see a couple of people here. I see Ivy here.
Yes, I have them here.
There are a couple of questions we don't want to. But what I will ask before my personal handbag join, please excuse me. She got so many names. She's my co-host, but she's my pujubu. She's my handbag. My personal handbag. She's my 2-8. So any other name that jump in my mouth, I will call it. But please know I'm talking to her. So Dr. Fist, it's good that this is very important that you guys will come back. But it's good that
Frida.
oh, it's good that we are discussing this because it's gonna be aired in Liberia. So I want you, our people back home. So just break the English down for us
Yeah.
so they can understand it because I want them to get it. The man is power packed, yeah. So I even know what to do when you on the show here right now, but
Bring it back.
I just will grab you like that, and just get you hug. But just break it down so the people in Liberia they can understand it too, because there are a lot of things that happen in Liberia and we don't understand. We just put everything in a box. The person crazy, you know.
All that witchcraft.
They have all that witchcraft. Yes, thank you. That witchcraft, all that, and some of these things, it has nothing to do with wish. But anyway, I will hold my peace. And Pujupu, please welcome these people and ask their questions.
Woo, Dr. Fix, thank you there. We want to say welcome to Brother Mike. Welcome. Avin Hayes, welcome. They are enjoying the show in the back. A lovely show. We have Sis great questions.
Welcome, Sister.
Josiah, welcome, Sister Josiah is watching all the way from India.
Welcome, Joe.
Welcome. And we also have Sis Annie Hester. She's also watching right from Minnesota. And she also has a question there. I know we had that discussion earlier, but maybe Dr. Fizz or Favor, one of you guys can go through that again for us at some point. So she has a question there. Has anyone diagnosed why mental health happen in a person?
Let me come in. Dr. Fitzway, dig deeper. I just want to say this. Mental health can be diagnosed in anyone. Sometimes it might come from the genetic line that he mentioned earlier. It's like any other condition. Sometimes it will start from depression, anxiety. Anxiety is considered as a mental health disorder. So there are a wide range of mental health disorder. And yes, anyone can have mental illness at any time. Sometimes you might have, maybe you're involved in an accident, and because of the scene or what happened, every time you see them, you just check, you start having PTSD, post-traumatic stress disorder, or maybe something happened in your past, and whenever you think about it, you just go into that panic mode. That's mental health issues. And all of these things, they do have medications. You can be diagnosed and you can be treated for it. So don't let yourself sit there and suffer and say, oh, I think this one, I just need prayer. I need to go for deliverance. Because a lot when my village people behind me know. Anybody can be diagnosed with any type of mental health, even though some of them are genetic. Bipolar disorder is genetic. The Down syndrome children, they can be born with it. Some whatever chromosome, the data that you go deep. But I just wanted to say this, that anyone, even I who's senior, I can be okay today in the next week or so, or 2-3 days from now. But what will I get? Maybe it's gonna terrible thing happen to me. And then I start going all of my head. Oh, unless you crazy, I thought you were okay. What you have to do is something that happened and just instantly threw me off, and I can't get a grip of myself. So it's always good to go and get checked out and get treated for it. Like you stated earlier. treat mental health like any other sickness or disease part of your body because it can be treated. You can get medication for it, and you can live a happy and healthy life. You can live a fulfilling life with having mental illness because there are medications out there, there are treatments, there are therapy that you can go for. So people shouldn't just sit there and think, say, oh, I can get help. I just want to train that other faces. Over to you.
So before Dr. Fitz come on, you were talking, and even when he was speaking, what came to mind? Um, Something I know a friend who was in this relationship for a long time. And in fact, they were not legally married, but because they've been in this relationship for a long time, they were almost like they were husband and wife, right? And so, and then to mess everything up, she never had her paper. And so she was depending on him to give her paper. And she had a child for him and everything. I don't know what happened between them. Some kind of cheating went on. And the man decided to walk away from the relationship and left her like that. Something triggered in there. And that lady cannot come to herself that today. I mean, she lost it. She went everywhere for help. And the only thing now she could turn to was to drink. Drink like fish. But she couldn't recover. And so I listened to him, and these are things sometimes that happen. It can be death, you know, it can be something dramatic can happen, especially back home, and then everything are witchcraft. Everything back home. If it's not our mom, it's our grandparents. Well, how can your mom be seeking to destroy your life when your mom carried you for 9 months? So back home in Africa, my people, if you guys are listening to this show, we are here to educate ourselves and to empower one another. That it's not everything that is your parent did it to you, your mom, your grandparents didn't want you to succeed. And so for this reason, it's a spiritual issue that after your life. No, sometimes it's just that thing.
Mental
That's
health.
something that you need to take care of. When you get a car, the car is acting up, you carry it to fix. We do sometimes.
Your brain be acting up.
They bring your act up. Because sometimes you get out in the morning, say somebody say good morning, you won't even be bothered.
Yeah.
You know? So sorry, but I had to add that to it. Please take it over.
Sure. And so let me just answer the broader question. The broader question was, are there ways to diagnose a mental illness? Yes, the same way how you would diagnose that a person has hypertension. So you are looking at criteria, right? Blood pressure consistently over days, so on and so forth, so on and so forth. So if all of these criteria are met, hypertension, how do you diagnose malaria? High fever, headache, so on and so forth. Once all of those criteria are met, malaria. How do you diagnose diabetes? The person has a sugar level that's above this level, that's above this point consistently, right? So you say diabetes. How do you diagnose jaundice? So when it comes to medicine, okay, diagnoses come as a result of satisfying certain kinds of criteria. Okay, so sometimes physicians and other health practitioners will go one step further and ask you to do lab work. Okay, as a way of trying to confirm what they have already assessed to physical assessment, and they can be like, okay, fine, I have a lab result that supports what I've seen physically. Okay, so when it comes to psychiatric diagnoses, we also have criteria that are met. Okay, let's take for example, post-traumatic stress disorder. Some of the criteria will be such things as whether you've been exposed to any life-threatening situations, any physical, emotional, sexual abuse, or neglect. Okay, so any of those things. Number one, did that exposure occur? Number two, as a result of that exposure, do you find yourself repetitively having flashback, triggers, intrusive thoughts, nightmares? Intrusive thoughts would be like what our Favor mentioned. Sometimes you're just sitting there, all of a sudden that thing that happened to you in the past, it come rushing back to your head, whether you want to think about it or not. Triggers would be maybe when that thing was happening, there was somebody that was cooking something on palm butter rice. So every time you
Exactly.
somewhere and people see you smell palm butter rice, you get triggered. It's so
You get
simple, but it happens. That's trigger. Okay. Nightmares. Because of that incident, every time you go to sleep, you find somebody chasing you in your sleep. Nightmare. Okay. So you starting and go, you gotta go
okay.
to go cussing because I keep having a bad dream. Well, Prizocin, 1 milligram POHS can resolve that. So if you took Prizocin, if I prescribe Prizocin for you 1 milligram at nighttime, you took it and it's still not resolved, or clonidine extended release 0.1 milligram at nighttime, still not resolved, then it's okay. Well, maybe it's something else, but there are always medication. Social anxiety disorder, okay, where people have difficulty being in the presence of other people, okay, or agoraphobia. They got some people because of any kind of post-traumatic situation that may have occurred. Anytime they find themselves in a situation where there's no escape, all of a sudden they become afraid. Okay. But let's talk about another one which could potentially be very prevalent among our African society. Okay. Anemia. Okay, that is low blood. Low blood, if a mother who's carrying a child has low blood, it also has the potential of affecting the baby, right? Now, what is the consequence of anemia? The blood molecule carry oxygen. So if you have insufficient molecule that's carrying oxygen, you have risk factor for something called ischemia, right? So then the baby also has that risk factor. So you have in utero insult, in other words, even though you are not born yet, but because of that anemia and ischemia, there's a risk factor that you have insufficient oxygen supply to that baby as well. Okay, so by the time the baby is born, there's some portions of the brain that have been significantly affected. So it doesn't have to be congenital. It could just be in utero insult as well. Okay. So the baby come into this earth and you think that, oh, the grandmother, they didn't like the mom married to the person and this. No, it was only because the mother was improperly fed during the period of pregnancy. So then you have a child that's coming into this world having psychosis because some parts of the brain are not sufficiently developed. The prefrontal cortex, for instance, the part of the brain, the most significant, the biggest part of the brain, okay, not sufficiently developed. And now you have them having auditory visual hallucination, command hallucination. In other words, something in their head telling them that everybody around them is bad. They need to take knife and kill everybody. Okay. Let's take it one step further. Let's just look at what's happening in Liberia, the level of poverty. And I also always argue this. Is it the war on drugs? Okay. There's a language. It's called self-medication. I think somebody just talked about it. Where somebody drinking alcohol, right? Self-medication. You worry so much you can't sleep all night. So what you do, you get some alcohol, you drink it. It works on the neuropeptides in the brain. So for a period you will sleep, but it's just masking the real problem. You will still wake up. You will have some elevated liver enzymes, which is even complicating things worse than anything else. But long story short, what is happening with that poverty, and as a consequence of which people start to use drugs and other substance, is that they are trying to find their own way to deal with depression. They're finding their own way to deal with anxiety, so on and so forth. So I have argued that one of the best ways of trying to deal with mental health, the mental health crisis, the drug crisis, and so on and so forth in Liberia, since it's possible this thing is going to be in Liberia, is the creation of jobs. Because if people know very well they can wake up in the morning and have an opportunity to take care of their business, take care of their family, and the rest of it, you don't have that overwhelming pressure that introduces the kind of depression and the kind of anxiety, which continues to remain unresolved because joblessness continue to persist. You see, so if that can be fixed, you've solved a significant amount of societal problem because now people don't have to go and self-medicate because they have the option to work. It's not only in Liberia, in the Western culture, when there was COVID, a lot of people committed suicide.
Mhm.
A lot of people. Uh, During the economic shortfall, when Obama took power, when there was that economic shortfall and there were a lot of foreclosures and stuff like that in the United States, a number of people committed suicide. The depression rate increased in this country as a result of that. So it's not just an African thing, it's a humanity thing. Okay. The more negative psychosocial exposure, the higher the risk factor that we will become extremely sad, extremely worried. And because we are extremely sad, extremely worried, we find ourselves sometimes hearing voices telling
Mhm.
us to do things. Okay. So that's the best way of trying to describe schizophrenia, psychosis, auditory visual hallucination, agoraphobia, so on and so forth, bipolar disorder, all these kinds of things. Okay.
Oh,
Prostitution. You have young girls because
Sylvie,
Manda, Pada, they have no access. And the first law of nature is the law of self-preservation. Nobody's going to lay down and die. Everybody is going to do whatsoever is necessary to be able to survive, up to and including sleeping with men that they may not necessarily want to sleep with. So they walk away, some happy, some going away with that trauma. Maybe you didn't want to sleep with a man without condom, and the man said, well, you don't want to give me the con. If I sleep with you with all con, I give you $100. If you make me wear con, I give you only 10. You needed that $100, right? So you
yeah,
let him have sex with you without condom. Then you start to worry. Is it possible that I may have developed syphilis? I may have developed HIV, so on and so forth. Now you take that worry because some people, depending on the level of health concern or what that health concern is, they don't even want to go and get confirmation. I don't even want to know I have HIV. So I would just sit down and perpetually worry. How do you fix that? You see, so these are the kinds of concerns that continue to remain unaddressed in the larger society. And I'm saying, in conjunction or speaking through the Favor Grace Clinic, that it's not just some hoax. Okay, these are real reasons that affect the brain, just the same way how you have a headache and so on and so forth. So there are medications to reverse these things, but even as you have medications to fix these things, we also have to talk about psychosocial intervention. That's therapy, something called cognitive behavior therapy, so on and so forth, where someone come and talk to you, okay, and try to teach you coping strategies in addition to medication to have a better way of dealing with the situations.
so the way you said it, well, keep that. Let me say something here. Um, it's good that there's gonna be relay in Liberia.
yeah. Mhm.
Um, because what bad for me is that you don't have money, you don't have job
Hmm.
to eat, you can't get it. But then, how do you sit there and just be on drugs? Where do they take the money from? How does it even work? And I mean, how can you think that's the best way to help your situation?
Yeah, that's a good question. And let me just, when it comes to drugs, what people need to understand is that by the time someone starts to take drugs or any kind of drug for that matter, even those that are prescribed, those drugs act on neuroreceptors in the brain. In other words, whenever you take medication, it has to be metabolized. In other words, something whether in the head or other parts of the body has to ingest it, and then it start to take an effect. Okay, even with a headache medication. Okay, so once those receptors become very sensitive to the medications that you've started to take, just because you're too sad and you don't want to think about the sadness, or you're too anxious and you don't want to think about the anxiety, what is happening and what people don't understand, because they don't understand the psychopath, they don't understand the medical reasons behind that in Liberia, is that once those neuroreceptors are developed and you deprive those neuroreceptors of that drug, oh God, it's almost like killing them. And we don't have any
Wow.
detox. It's called detox. We don't have detox facilities in
Yeah.
Mm-mm.
Africa.
Yeah.
So you can imagine the level of distress that those people who were taking drugs and now have to uh, get off those medication. Mind you, now let me show you how bad it is. If you are taking a benzodiazepine, for instance, is one of those medications that you
Yeah.
would use for anxiety. Xanax would be your favorite one, and Xanax is short acting.
Mm-hmm.
If you are taking Xanax, and
Mm-hmm.
then all of a sudden someone has to tell you, stop taking Xanax, boop, they pull it away overnight. The first risk factor you have is seizure.
Mm-hmm.
It can be deadly. Okay. Even alcohol, if someone has been drinking alcohol for a consistent length of period and then have to just one morning wake up and don't drink alcohol, they can develop something called delirium tremens.
Yes.
It's also deadly. Okay. So you have, so all of these things are the kinds of exposures. So some of these people that have started using substances may want to get off the substance, but they
Yeah.
don't have the tools
Yeah.
to safely get off those substances, which is something people don't even know about in Liberia. So
Mm-hmm.
they just think, well, okay, well, you start using, you don't want to stop taking drugs, you just on drug. Yes, because some of them cannot. Without the professional help, just taking it away from them like that is
No, bad.
tantamount to just killing them. That's how bad it is, because some types of seizures, you go into them and basically you can lose your life. You see,
Wow.
so these are some of the complications that people don't understand with these things. So prevention is better than cure. And the best way, the most preventative way to deal with all of these problems that we've mentioned, okay, like a mother going hungry and having child who may have significant reduction in red blood cells and stuff like that. So you have insufficient brain power just because you have diminished oxygen supply to the brain of a child. Okay, or through labor, the you don't bring the baby out properly. Maybe the baby stay longer in the womb before come finally coming, or you have all of that kind of insult. Okay, all of these things because problem. So to fix the problem, one of the things that need to be addressed is a level is joblessness. Fix, give people jobs. When people have jobs, they have empowerment. You can't do everything, but what you are doing, even if it's 1% of the population, what you'll be able to do to them is to get them away from anxiety, get them away from depression, get them away from suicidal ideation. A lot of people beginning to commit suicide. A lot of people are beginning to commit homicide in the country. It's because of hopelessness and helplessness, which are also facets of anxiety, depression. Okay, so people just see it, just take it for granted. Oh, the person wicked. No, not necessarily. But just because the hopelessness and helplessness, there's no justification. No, I'm just trying to explain the psychopathology behind the reason why these things are happening. You
That
see,
often or
so
today.
medications can help it. Okay, therapy can help it. Medication and understanding that you have withdrawal effect once people start to use drugs. Then people would not say, oh, like most of the time they show on on Facebook and stuff like that, you see these guys lying down like they are dead because a lot of them are going through withdrawals, and people don't understand that. But then you have them, some of them, their heartbeat is like 50 beats per minute, and people don't even know that. You see, or some of them is they have become tachycardic. Their heart rate is going almost 200 beats per minute, but they are just lying there. But nobody has the medical knowledge to go and test them, to do a radio pulse check, to be like, this thing is serious. Because what? They may be in withdrawals, but people don't know. You see, so everybody just stand around and boom, the next thing you know, the person is dead. So that's the level of education, that's the level of sensitization that's lacking in the country, you see. And it's very needed because people are needlessly dying in the country simply because we don't have that knowledge.
Wow.
You know, when you were talking, it's just like a woman, because that's what came to mind. So that's why I'm saying it. Well, it could be a man too, a woman or a man. Let me put it that way. In an abusive relationship, right? And you telling the person to just get up and leave. It is not that easy.
Yeah.
You are in there because there are a lot of things, and sometimes you on the outside, it seems like, well, what's wrong with her? What's wrong with him? Why it is the relationship is not okay? Why can't he or she leave? It is not that easy. So when you're talking about the drugs, that's what came to mind. It's just like that. And sometimes it's like you hear all of these things around you concerning drugs, what it's doing to people, but you still go, especially the people in Liberia, to be honest, I can't get it. You don't have money. You can hardly find food to eat. All of these things. And then drugs, drugs, drugs. But thanks for breaking it down because that's what came to mind. It's like you're in an abusive relationship and it's not good. Everybody around you see that it is not good for you. You in there, it may click that it is not good, but how do you get out? You may not have that willpower or that, you know, courage to get out. Janetta, do you have a question?
Um, no, I don't have the question right now, but I know the comment section has a lot of questions and comments going on in there. So I think we will, dive more on that end. Then I will reserve my questions for now. So let's go
Okay.
into
Let's see what they have. I
the
don't see
audience here. Welcome, Brother Doe, Johnson Doe. Welcome.
Oh, welcome.
I guess that's his first time he petty on here. So
Okay, welcome, Mr. Doe. It's good.
Welcome, Josie.
all right. Johnson question here is what are the primary factors that lead to mental health disorder, and does excessive work without enough rest lead to mental health problems?
Yeah, I think I
Yeah,
mentioned that
answer
earlier.
that for me because
I
I
think
need I need
Yeah,
that.
well, please answer it for her.
yeah, I think I mentioned that earlier. And let me just restate.
Hey.
Whenever your your brain needs time to rejuvenate, it needs a period of healing. There's a portion in the brain, I think it's in the temporal lobe. It's called the limbic system. That's where you have the hippocampus that's responsible for short and long term memory and the rest of it. You have the hypothalamus, okay, the hypothalamus, uh, and then you have the pituitary and the rest of it. All of these things are interacting, okay. At some point, they all need to rest, okay. Which is why sometimes I even tell people, as like, if you really want to have good rest, cut your light off. Because if you're not cutting your light off to sleep, what your brain, that light alone is preventing something in your brain called the pineal gland, okay, from producing something called melatonin, okay. So you have
Give it
endogenous
to us,
production.
Dad. Give it to us.
Yeah, you have the brain manufacturing melatonin that puts you to sleep to rest yourself, okay. And by the time you are resting yourself, One of the most significant reps you will have is something called RAMS, rapid eye movement. Okay. Somebody phone me, I know that on my phone.
I think that you because now oil.
Where are you?
Then I mean,
Mm.
Okay. Yeah, go ahead, Doc.
when my
Enjoy.
phone ringing. Anyway, so as I was saying, so the REM sleep, okay, in the absence of the REM sleep, you don't have the rejuvenation that you need. So with the lack of proper sleep, what is you have the hypothalamus that's not working well. And once that is not working, what you are doing is preventing you end up having hormonal imbalance.
Mm.
Okay. Hormonal imbalance that can affect different aspects of your body. Okay. And it gets so severe. There was this time I had someone who worked overnight. I think that was the first time working an overnight shift and came home the next day and had suicidal
Oh,
ideation. Yeah,
Jesus.
felt like committing suicide. Okay. Other than that, uh, what about situations where you have a boss who's always telling you that your performance is inadequate?
hmm.
So by the time you are walking through the doors of your job, you
Yeah.
begin to have anxiety, high.
Mm.
Okay. So by the time those patients are walking through the door to see me, I'm asking them, are you sleeping? Which most often may not be so. Okay. Maybe prescribe gabapentin 300 milligrams at night and then do another one BID, in other words, 2 times during the day. Get them to feel much better. Abuse Bureau 5 milligrams 2 times a day as an initial dosage, and then perhaps maybe elevate the dosage depending on how well they feel. Okay. So long story short, depending on it's not just only at work, it's also at home. So you come home, you have a number of activities, but you find it difficult just because one child is trying to climb up your head, the other ones are doing this, and so on and so forth. But you are not able to regulate all of your activities in a way that the sequence of it make it easy to work through your chores at home. In situations like that, what would happen if a patient walked through the door, and in this case through the Favor Grace clinic doors, what I would be doing is prescribing a psychostimulant for them. That could be anything from methylphenidate, such as a Ritalin, Concerta, stuff like that, or perhaps um, Adderall, okay, amphetamine, Adderall, Dexedrine, so on and so forth. Okay, so long story short, yes, there are work conditions that can be so hostile. Okay, not just only work conditions, school conditions. What if you are in you are from a high performing family? Okay, the expectations for you are so high, but you find yourself in an academic situation that is way over your head, but you don't want to become um, you want to be a success story to those people that depend on you. It creates a lot of anxiety. I see a number of such patients. Okay, I have a number of patients, some of them physicians, some of them lawyers, so on and so forth. And these are high performers, and you would be surprised the level of pressure these people are constantly under. Okay, especially when it comes to performance and wanting psychostimulants. Okay, especially when it comes to performance and wanting uh, um hypnotic medication for sleep and so on and so forth. So I would encourage those who have all of these questions to understand, like I've said, just the same way how the hand can get problem, the foot can get problem, the chest can get problem, the stomach can get problem, the head, as in headache, the head, as in you need glasses, the ears, as in the head, as you would need medication if you have any dysfunction of the ear. So too the brain, because you have neurotransmitters, you have neuroreceptors, you have structural abnormalities in the brain. That if there's a dysfunction of any one of these things I've just listed,
No
it
problem.
suffices to have some kind of medication, and not only medication, a more holistic treatment will also be psychosocial intervention, where you would have a therapist that would introduce such things as cognitive behavior therapy, so on and so forth.
So all of these mental stages or
Mhm.
issues that we are talking about,
Mhm.
um, that require medication. Well, I think I have two questions, and I will throw it at you because you good to go.
Yes,
So you know your thing. So if I mean, do you always take it? Is it for the rest of your life? That's one. The second one, is it a mental issue if you someone that found it difficult to sleep at night?
You make, you're making me laugh, and the reason why you're making me laugh because the question is the same kind of questions I usually get asked by my patients. So
We
I
patient
usually so I usually have these patients who've been, all over the place, and they've not found any kind of mental relief. So now they walk through my doors, and sometimes after you've practiced for some time, you just by having a conversation with the patient, you know exactly what's going to work for them. So you prescribe it, and then overnight they have relief. They always ask me the next question: so, is this going to be perpetual? Where can I get off it? And then I'm like, nah, take your time. But as far as the literature is concerned, let me just answer that question. Let's look at depression. Okay. If you've had a depressive episode for a first depressive episode, you are supposed to, according to the literature, the research, you are supposed to be in an antidepressant for at least a year. Okay. Been, if you've had a second depressive episode, you're supposed to be on an antidepressant for at least 2 years. Now, if you've had more than two episodes of depression, you are actually supposed to be on an antidepressant for the rest of your life. Okay. And how I try to mitigate the fear with my patients is that I usually tell them, I'm like, there's a lot of things that you do every single day that you take for granted. So just adding one more, as in taking a medication, shouldn't be much of a problem. I'm like, you eat every day, you go to the restroom every day, and there are a lot of other things, some private, some public, that you have to do every single day. So just adding one medication shouldn't be much of a problem. And then your second question, you asked whether, what was the question?
Having problem to sleep at night, is that a
I'm having problems to sleep at night. I think I answered it, but let me just reinforce. By the time you go to bed, you have structures in the brain that kind of recalibrate by the time morning is coming. Okay. Now, if you've not had the opportunity to recalibrate, what is happening is that you have uh, dysfunction. Okay.
yeah?
Which is why, and one of the dysfunction is where people start having auditory visual hallucination. Okay, you start hearing stuff, you start seeing stuff that may not necessarily be real. Okay, if you are having insufficient sleep, you could significantly impair the volume of serotonin, the volume of norepinephrine, the volume of acetylcholine, so on and so forth. So the risk factor is that you start having um, retrograde or anterograde amnesia, stuff like that. Okay, so there's a lot.
Break it down.
In other words, you find it difficult to remember stuff that happened in the past, or sometimes you find it difficult to remember that you've just decided to do something. So there's retrograde, as in something that may have happened in the past, you start to forget it, or anterograde, you would make a decision right now, and before you know it, you just forgot that you've said something that you want to pursue. Okay. So all of these complications, all of them are happening for one single reason, that you've not allowed your brain a period of rest. Okay. So you have a persistent performance of your hypothalamus and so on and so forth, that's working. and not resting. No, they do need that period of rest. If they're not working, resting, these are the risk factors. Okay. Especially for people who have bipolar disorder. Okay. So people with bipolar disorder, there are certain instances where they go, especially when they're in something called a manic state, they can go days without sleeping. Okay. So as the days continue to accumulate, it continues to get worse until they have a final crash. Yeah, so it's real bad stuff. But the hope here is that you do have medications for all of these things I've talked about.
Yeah.
Okay. You just need the right combination. If it's auditory visual hallucination, you do have first, second generation antipsychotic. If it's bipolar disorder, you have anticonvulsants. If it's depression, you have first, second generation antipsychotic, you have tricyclic antidepressants, and so on and so forth.
Yeah.
So, number of medications to deal with
That
all of
one.
these.
See what I into the will learn.
So that's
It's very. It's very educative. You know,
So,
I gotta give it up for this time.
yeah, you know your
I'm telling
something.
you, come on, say,
Calling you,
say,
you know your thing. You
you
know your
and go back to the drawing board and see what we can make some corrections.
So, Pujubu, do you have any other question? If not,
There's a lot in the comments. I'm just going through here. There's a lot of questions. I know we're supposed to be wrapping up, but I will do my best to get through everybody's question and
maybe
comments
double
here.
it too, so that he can handle it. Double it too.
Yeah, but I'm really enjoying the doctor. I'm not gonna lie. But before I come back into the comment section here, I know I keep hearing a lot about medication.
Mhm.
It's pretty much everything pertaining to the mental health. Just I know you talked about getting the therapy piece of it, but what if can somebody just deal with getting that counseling section without the medication piece of it? Take for example, I just wanted to come in. I'm just gonna use one of the example we've been using all through. I break up with my boyfriend. Let me assume I break up with my boyfriend. I'm going through this.
The boyfriend.
No, okay. So
Okay. No,
I
no.
break up with boyfriend.
All
No,
right.
leave that other- I'm just assuming,
Okay.
break up with boyfriend. I'm going through a problem. I just need someone to talk to that can help me ease of whatever I'm dealing with, that depression, everything. I just need to just talk to someone to get it off without going through that medication process. Is that something that can be done, or everything has to go through medication?
That's it's interesting, is risky.
Right.
It's extremely risky. The reason for that is by the time someone is anxious, depending on the degree of anxiety, by the time someone is depressed, depending on the degree of depression, the next step beyond that may sometimes be suicide. Yes. Okay. And the thing is, when people contemplating killing themselves, sometimes they will speak up, sometimes they would not.
Yeah.
Okay. And the act of suicide is the highest degree of impulsive behavior. At that moment, when somebody decides that they want to kill themselves, there's nothing rational about that decision. It happens in an instant. Okay. So if someone is so sad and you try to talk to them, there's nothing that's penetrating. Nothing. Okay. Not absolutely nothing. It's like there's a shield that's batting off anything that you are saying.
Wow.
I once had a patient who, like, because of HIPAA, I can be very specific, right? Say, like, Once I took the medication, those things that made me sad did not stop. But for some reason, the impact of that sadness I'm not feeling like before. That's how a patient described it. Okay. So some of my patients, right? They come to me and be like, oh, I'm anxious and I'm depressed. And I'll be like, especially during the time that you are anxious, do you take some deep breaths just to calm down? And they're like, no. I'm like, why? Because at that moment, for some reason, I'm not just able to do it. And the reason is simple. At that moment, you have the neurotransmitters in the brain. So, for instance, you have glutamate, right? Glutamate is a neuroreceptor that's responsible for something called kindling and seizures. So, if you have a high number of glutamate activity in your brain, what kind of talking you come to kind of get somebody that will listen to you? Because the brain activity, okay, you first need medication to bring it down to a level. When it's down to a certain level, you talk and go. It's like somebody have headache, right? You come ask the person what your headache level, or let me talk about it in a way that you can relate. A woman is about to give birth, right? She throwing her clothes all over the place. They tell her, no, go yourself.
Which
Hmm?
even causing you.
Thank you. That's exactly what it is. Until that pain is abated, there's nothing you're going to tell that woman at that moment that's going to make any sense to her. Nothing. Just forget about it. Okay. So it's something similar. Depending on that level of depression, that level of anxiety, if they don't have medication that's going to lower that temperature, all you are doing is like someone having agitation and aggression. Okay, someone attacking people, someone hitting people. There's a clinical medication, especially when I work in patients, called B52. It's Haldol 2 milligrams, Benadryl 2 milligrams, Haldol 2 milligrams, Ativan 2 milligrams, and Benadryl 50 milligrams.
Correct.
Give them that injection after 5 minutes because it's IM, right? So there's no first something called first pass effect. In other words, it doesn't have to be metabolized by liver, all that kind of stuff. After 5 minutes, that person where 10% needed to subdue to be calm, that same person can sit down on the bench and come back to you and say, oh, you injured? See, yeah, you did it to me. Oh, I'm so sorry.
Not correct.
Exactly. You see what I'm saying? So it's not, like when people say Saka. No, it's activities in the brain that firing. Okay, and you need medication to bring it down to a level. Like I tell my patients, it can, my patients who suffer from anxiety, it can be like, oh, yeah, I'm like, is the medication working well? I'm still anxious a little bit. I'm like, I'm not trying to take your anxiety away because if you have an active shooter, I need you to run. Okay. So in other words, it's good for people to be anxious. It's good for people to be depressed and so on and so forth. But when it gets to a pathologic level, in other words, when it gets to a level that's destructive, then you want to take medication to bring it down. It's like headache. If a person headache is 10 over 10, there's nothing you're going to do for them until that headache comes down. Okay. So bring it down a little bit and then you can have a conversation because now they are willing to listen to you because all those neurotransmitters that were on fire, you've been able to rein in just because you've given some medication.
So you talk
Wow.
about electrical, it made me to think about someone who can lie. The person lies much until it get chronic now. Then they call it a pathological liar because everything you say we have to check. It raining, you say the sun shining. Where's the sun shining at? So um Do you have any question on there? If not, I have my last question and will be one.
Yes, I do have question on here. I'm just gonna go through some comments and then the questions in there.
Again, just before you go through the comments, we want to welcome you. This is juicy. This is interesting. This is whew,
Maybe you have
breathtaking.
to come back on you.
Oh yeah, you have to. They gotta come back. Yeah, favor. They gotta be back here. So
Yeah.
we want to welcome you. We are having fun again. Invite. We are still here. We have a few more minutes to be here, but it is very interesting. We want you to not miss what we are learning. But in case there are friends and family that you know that will be benefited from this discussion, please share, like, and comment, or share it with them. We are very happy to announce that this will be airing in Liberia as well from Monday beginning to tomorrow, 9:30 p.m. Liberian time to 10:30 p.m. So whatever we do here going forward on this platform is also going to be airing in Liberia, and we are grateful for that. Jonathan, back to you.
Congratulations.
Thank you.
Thank you. Alrighty. Andrea, she said that's the most scariest part. Some people end up leaving this world early due to mental health. It's
Mhm.
scary when they black out and don't know what is going on around them. That
Yeah.
is true.
When they can just take a little medication, like the doc said, right?
Yeah.
But it
Yep. Um, Brother Doe came back and said, what would be the initial approach to treating mental health disorder? Is it counseling first and medication after, or ver- vice versa? I think he
You
just
already
went through that.
answered. Yeah.
He just went through that. So, Mr. Johnson, if you are listening, we just had that discussion on here.
But I think he said, let me come in. I think Dr. Fix said it's advisable to do both. You
Yeah.
cannot do one or the other. So Jesse Johnson can be clear. You have to do both. Go in and see the provider. He prescribe medication, and then he's saying you, if he's not doing psychotherapy counseling for you, he can give you a referral, because you have to do both in order to be stabilized. And it's a continuous process.
the woman must say stabilize again.
You need to be stable, because you can be unstable. You know what it.
Alrighty, brother Mike. He said mental illnesses are disorder ranging from mild to severe that affect a person's thinking, mood, and behavior. Correct me if I'm wrong. What is the ratio of mental illness in adults and children, specifically within Liberian community, considering our past history, 15 years of silver crisis?
Hey,
Wow. Before the doctor crying on that one, brother Mike, let me be honest here with this one.
that whole several topic right there.
Me, I'm not a doctor, but based on this whole thing, and he's, going through the Liberian community, Liberian people, we here, we do not make use of this mental stuff. We do not. Whatever we are dealing with, we feel like we can handle it ourselves, or we feel like we are losing our mind, or somebody will call us stupid, or call us, excuse my French,
Crazy.
crazy,
Or
when we decide to go get ourselves checked out. Over the last month, a month or so, we've been doing this training. I will have the doctor come in to answer your question. But we've been bringing awareness to people, especially in our community. It is very important you getting yourself checked out, your mental health. It doesn't mean you are crazy.
No.
There are so many things that we are dealing with ourselves. Sometimes we just need that break for ourselves. Just get yourself checked out. Get yourself treated. It doesn't mean you're crazy, because most of us, I myself, who here, I had that same mentality. I feel like, oh, if I go and say, oh, I'm going to the mental health clinic, I'm crazy, I'm stupid, I'm this, I'm that. I will feel that way, but that's not the case. There are so much help out there for us. But we have to admit that we are dealing with something first. And we as African or Liberian, I should say, we do not want to accept that. We don't. So therefore, it's hard to really get that ratio that you're looking for. You will see the black and brown people will make use of that, apart from the Liberian, because we are black and brown. But I'm just going to say, a lot of people are making use of that. But we Liberian, we don't want to accept it. We don't want to accept that we need help. We don't want to accept that we are going through something. Even when we are depressed, we want to be in that denial stage. When we have bipolar, we want to be in a denial stage. We think everything is okay, and it is not.
Spiritual.
Yeah, we always want to carry it on our spiritual side. Oh, I need deliverance. Yeah, please pray for me. It is not okay. These people are here to help every one of us. Dr. Bantu came on here to elaborate more about this. How can we help ourselves? How can we get help from other people if we cannot help ourselves to admit that we are dealing with something? It has to start from us. If you can admit that you're dealing with something, you have providers here that are here to help us in coping with whatever that we are going through. So, let me leave it up to the doctor for now to see if he got a ratio with that since he been in the field for a little bit, But I was just trying to bring that out because we are not being truthful to ourselves. Doc?
Before the doctor come in, where the Bible talks about lack of knowledge, my people perish. It's one thing to be lack of knowledge, and it's another thing to know or to have that knowledge and decide not to do anything about it. And to be honest, we ourselves, we are benefiting from these various topics or different topics on here because we have to make research and then we find a lot of things. And even from the discussion, though the doctor used a lot of terms, I'm not a medical person, so I can't go there. But here is it. We have this information. What are you going to do with it? You are not crazy, but it's good for you to check. It's just like if you hear a little sound on your car, you want to go and check it because sooner or later, if you don't check it and do something about the lid, click, 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 it will end up, it will be a bigger problem. And then you have to spend more than what you are going to spend before. It's the same thing with us as human beings. So what are we going to do with all of these informations that we are getting on here? And we know we need help. We don't like to ask for help, especially when they say mental, we say crazy. So we even want to go there as Liberians. That
Yeah. So let me answer the question this way. Whenever I've worked inpatient, because inpatient is more urgent versus outpatient, because outpatient is situations where by the time an individual is coming to you, they are, so to speak, stable. Whenever I've had very critical cases, people trying to commit suicide, having a psychiatric breakdown or manic episodes, stuff like that, there are three things I've seen repeatedly. Okay. Number one, I've seen someone who has a low level of education. It doesn't mean rich people can't get sick, but predominantly, most of those patients who are having these psychiatric problems, they're always low level educated people. That's the first thing I've seen repeatedly. Like I said, it doesn't mean to say educated people don't get sick. They do. Okay. That's number one I've seen. Low education. And number two thing I've seen, poverty. Okay. Jobless, on food stamp, unable to pay their bills, so on and so forth. Poverty, joblessness. That's the number two thing. It doesn't mean to say people who have jobs don't have these psychiatric breakdowns, because I also mentioned that people can develop anxiety from the job, either because they are underperforming, either because they have a hostile work environment, so on and so forth. So it doesn't mean that because you have a job, you can't be like that. But predominantly speaking, by and large, most of my patients, the second thing I've seen is poverty, joblessness. The third thing I've seen with most of my patients who have dysfunctional situations, dysphoria, and the rest of it are from dysfunctional homes, especially single parent homes.
Hmm.
Okay, most of the time we ask them, be like, oh, are your parents married or are they together? Oh, they are divorced. It doesn't mean to say people who are together don't have kids or relatives who have psychiatric conditions. No, they do, but in the majority. Okay, so as applied to the Liberian situation, we know that there's a lot of need to be met as far as the educational system in Liberia is concerned.
Yes.
There's a lot of fixing that needs to happen. Okay, the University of Liberia is just in a sad state, not to mention a number of other tertiary institutions in the country. And then, of course, there's the issue of poverty, okay, which is rampant and widespread. Okay, post-war Liberia, I mean, you have people keep coming, just to keep talking about, oh, we need reconciliation. What are you talking about reconciliation almost 20 years after the Civil War? You know, so for me, I always say the best reconciliation is to provide job opportunities for the people. Because and people go, oh well, we've been peaceful. I'm like, peace is not the absence of gun sound. Peace is as defined by me. I mean, not necessarily be an authority when it comes to that, is when you can go to bed knowing full well you wake up in the morning and have all of your, or at least most of your situations addressed. Just because you know where you're going to find money to take care of your home. You know you're going to have peace. You know you're going to have a restful mind. Just because all of your issues have been addressed, that's peace. And one of the things that make it possible to be able to do these things is money. And a lot of people in Liberia continue to remain jobless. And as a result of joblessness, people are turning to self-medication. It's not only a Liberian thing, self-medication, it's not only Liberian. In America, people self-medicate with drugs. Okay. So the epidemic that's in Liberia is a natural corollary of the poverty that's existing because of joblessness that's occurring in the country. And it can be addressed for me. I mean, diverting from health to economics, it can be addressed by public sector job employment. Because while most of when people talk about private sector, the private sector of Liberia is controlled by Asians. Most Liberians don't have the economic means and economic power to do so. So, but we know that government has the largest residue of funds that it can reinvest into public sector job creation beyond just the military and the police. Like I always talk about agro factories, because now you are using Liberian farmers to provide the raw materials. So now you're incentivizing farmers, and then you're also creating factories that are creating jobs that will also, and because these jobs are in different counties of Liberia, you have a depopulation of Monserrado and Monrovia because people go to those areas to look for jobs and then carry development along with them. Once you have more money circulating in the country, you're going to have an increased GDP, and then the society becomes a more happy society. That's more a better definition of an enabling environment that the government is trying to seek. So I'm hoping that with time, all of these things can be addressed so that the epidemic in Liberia can be turned around. And then we should not forget that if and when we see these things, we also have to take into consideration that there's also a withdrawal effect for those people who are using these substances. So whenever you see these guys all lying in the street and stuff like that, it's because they would do anything to get those drugs, up to and including hurting or killing another person. Because why? The withdrawal syndrome that they were going through whenever they are abruptly stop using these medications is tantamount to getting them to a place where they could even lose their lives. And the first law of nature is a law of preservation. Thank you.
The questions are many, or we have to let's keep it going to ask to answer these questions. I didn't realize it.
I didn't. Yeah, I mean, I kept seeing it coming through. I just want to welcome my daddy and my mama. Mr. Andrew Kier, welcome.
Ooh,
Thank you for tuning in.
welcome, 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 welcome. Thanks for giving me a beautiful personal handbag.
Alrighty. Andrea, she said, I never knew this. Andrea in the comment section a lot. She said, that my first time hearing the word with Dr. Chat. I have to go Google it and see what it means. You finished with all the doctor dropped a lot on us today, but a lot of educational stuff. So even me who if I go rewatch this show, I have to learn some things. And Doc, I come and take some nursing thing from you, baby. I don't lie.
We'll be at your door, always at the door. Awesome.
Oh, okay. Andrea, she said, fast, cause some days the middle of my head burns when I ain't get enough rest for days. Till I sleep, that burn doesn't go away. It's so uncomfortable. That comment
Come
came
see us. Come see that fix.
from that comment
Okay,
came from when
women.
the doc was explaining about when the woman asked the question concerning the sleep.
Okay,
So
appointment.
again,
Come see us.
Andrea, you can come and visit the Favorite Grace Wellness 6160 Summit Drive.
Mm-hmm.
Okay.
Brooklyn
That
Center.
is
of
located
Health
in Brooklyn
and-
Center. Okay, Dr. Brother Mike, he's here again. Dr. Fix, could you please elaborate on what neuroceptor are related relative to mental health for clarity?
Oh, you have all of them. You have dopamine receptors. You have, well,
Wow.
you have monoamines. You have
Oh,
amino
yeah,
acids.
so picture me, yeah, yeah.
You have acetylcholine. You have neuropeptides, and all of these have different kinds of receptors. But what is happening is that, so take for instance, someone drinks alcohol, right? And I usually tell people, okay, the neuroreceptor that's responsible for anxiety, depression is a monoamine, serotonin. So if you drink alcohol, alcohol may not necessarily be affecting that. It may be affecting dopamine receptors. It may be affecting neuropeptides. So you are not necessarily resolving anything. Okay, what you've done is to just put a curtain over a bigger problem, like applying a bandage to a big sore. By the time, because every time you take a medication, it has something called half-life. In other words, that's the period at which it is effective, and then it diminishes. The effect and potency of the medication diminishes. So by the time the half-life wears off, there's a recurrence of whatever indication that may have caused you to use the substance in the first place. So then it becomes a repeat that's going nowhere. Okay, as in the case of someone who says that, oh, well, if I'm not sleeping, I have a headache. Okay, what if that person is resolving the problems by doing something else, right? They say, okay, well, take Tylenol PM. Tylenol PM may not necessarily be a hypnotic medication. So you want to take maybe trazodone 50 milligrams or maybe hydroxyzine 25 milligrams, POBID, and stuff like that. Okay, so get something that addresses the actual problem. So then it goes away. Okay, so if, like, I think what the question is concerned about is, okay, is it possible, if there's something specific that's bothering me, is there a specific medication that can address that? And the question is yes, resounding yes, because you have those. If you have ADHD, it tells me that your dopamine receptors are not within the functional state. So then you need some psychostimulants. Then I prescribe you psychostimulants. If you have bipolar disorder, then it tells me that your different neuroreceptors are not working well. I throw some anticonvulsant your way, and so on and so forth. If you're agitated, having auditory visual hallucinations, I can make a determination between going through a first or second generation or perhaps a third generation antipsychotic medication. So all of these things are there. If that's the specific question that you're asking, then the answer, of course, is yes.
Udugu, I saw your mouth open. Like, keep going. The questions
The
are many.
question plenty that one.
Well, we're not moving around today.
Because I'm watching from the phone here and I'm also seeing the screen. And based on what I got on the phone and what's on the screen here, it's two different things.
Ooh,
Dr.
like,
James
keep
is
going.
in the hot seat today. Look. Well, okay, Brother Mike, I think you have the answer to that. Brother Mike, again, he said, what can you say about the side effect of mental health medication?
Well, it's not just a mental health medication. Every medication has side effect. Okay. So I think your question is, can a medication be prescribed safely? That's the question. And of course, yes, it can. And the principle of safe medication administration, even though, because the thing is, by the time a medication hits the market, in other words, it has gone through a number of years of experiment just to make sure it's safe. Okay, and they are able to establish what the therapeutic dose of that medication would be, and they are able to establish on the basis of that therapeutic dose what is a steady state, which establishes how frequently you give medication, so on and so forth. Okay, so I guess what I'm trying to say is that medications are safe because of how they are prescribed, even though there's a general statement be like, start this medication at 50 milligrams. That is because research has shown that at 50 milligrams there's high potency and there's therapy. However, taking into consideration that every patient is different, every patient has a different way of metabolizing medication, there's an understanding that perhaps maybe the patient is taking other substances in addition to that medication. Take, for instance, maybe the person is a smoker, right? So there are two principles. It's called induction or inhibition. Okay. So medications that are taken can either be inhibited or induced. While medication is inhibited, what's going to happen is that it's going to build up to a toxic level. If it's induced, in other words, it burns up so fast, it's not as effective as it should be. Okay. So all of these different things are there. Okay. How is the P450 system metabolizing medication? Is this person a fast metabolizer naturally, or is he a slow metabolizer? Are there substrates, okay, that are impacted? All kinds of different kinds of stuff. So long story short, once you are approaching prescribing medication, how I do it is that I always prescribe subtherapeutically. In other words, I start with the lowest dose that's possible and build up from there. I always tell my patients, I always treat patients like there's a COVID situation. So the first thing I try to do is to establish a safety profile of the medications I give to patients. Now, if a patient tells me that, oh, I'm not having any side effect, okay, the next thing I do is to try to incrementally, cautiously, but incrementally get the medication to where it's therapeutic. Okay. Any medication, something as simple as trazodone, for instance. One of the major side effects of trazodone is priapism. In other words, especially for guys, is an erection that will require an injection in the penis.
Get what?
Okay. Yes. Okay. Now, why would I go and be telling someone who has difficulty sleeping, be like, oh, well, if I prescribe you trazodone, there's a risk factor for priapism? I've been prescribing for 5 years. I've never heard a patient come back to me and be like, oh, I have this. Okay. Or lamotrigine is an effective medication for bipolar disorder, but it also has risk factor for something called Stevens-Johnson syndrome, which is
Stevie
condition.
Johnson, you having symptom again?
Yeah, exactly. It can be fatal. Okay. You start with rash. If you have rash, you have systemic fever, stuff like that. It can be fatal. Okay. So I start low as well. Okay. By the time you tell me, oh, well, I'm having rash, I discontinue the medication. So yes, you can. There can be a safe approach to how medications are prescribed, even though there's a general. Every medication comes with a general
Something.
rule. Start at 50 milligrams. Start at 100 milligrams. But it's very possible person A could actually start at 50 milligrams, but person B, that 50 milligrams could land them in the ICU. You never know. Okay.
Janetta, the next question.
Okay. Sis Essie, today's topic is an eye-opening
Welcome,
lesson.
Glass.
People is an eye-opening lesson. People need to hear this because not everything we blame Satan. People need to be educated about their health. Thank you.
Yeah, you're right.
Andrea, she said, LOL, we plenty of because we don't sleep. I wish she said, I wish they had one shot that lasts 1 month for stubborn patient. We don't who don't want to take pills daily. That we don't want. We don't like pills. When a man knows his job, it's like water.
Mm-hmm.
Well done, doc.
That didn't
I'll
work.
I'll give it to the doctor too because
You shut up straight.
Andrea, they do have one shot. Okay. Sis Annie is referring to Andrea comment there. She said they do have one shot for that mental health clinic give to the patient.
I'm visit Dr. Fix.
Yeah, you can see Dr. Fix because Dr. Fix really whistling on to there.
Can't see you. Look at all the options. We'll get an appointment on.
Andrea, she said, and this is where education once in. We ought to stay educated in all areas of our life. That's where I learned this year.
That's what I mean.
That's what I learned this year. Again, the clinic address is on there, the website, and then the phone number is on there. If you're watching, you will see it in there as well. Okay, I think this is the last question. Brother Johnson Doe, he said, why in most cases authority will turn to mental health evaluation for an offender? We can say that word here before Facebook
Leave it to
to
offender.
determine sentencing.
In this mental.
Let me see the
Everything
question.
comes
Yeah,
from
Dr.
the
Faith, if you can see that, I cannot say the actual word because we will get blocked.
Sentencing. Well, the thing is, that's a good question. What if the person had a previous mental health evaluation that showed that the person was suffering from schizophrenia and had a chronic condition of command hallucination? Okay, and command hallucination is one of the worst types of schizophrenia. Just because you have someone telling you that, oh, Janetta, if you don't kill Janetta, she's going to kill you tonight.
I,
God forbid.
if,
Yeah.
if you don't use the other term.
Oh, you
God,
use that.
Yeah.
God forbid. I mean, I'm discussing a clinical situation because it happens. Okay.
Uh-huh.
Yeah. So it's strictly medical. Okay. If you don't kill Janetta, she's going to kill you. That's command hallucination. Okay. So at the end of the day, that person comes and commit a homicide. Somebody come and commit a matricide. Somebody commits a patricide.
Aye.
So it easily happens. Okay. So during a psychiatric evaluation, the first thing you want to get something called collateral information, right? So you go in and, as in the case of the United States, sign something called release of information, or they won't have to sign it just because of the nature of the case. Get all of the information that's relevant to that person. Okay. And then you will see from the record that, okay, well, this person had a diagnosis of schizophrenia and this person was on A, B, C, D medication. Okay. So now you do an additional evaluation. Okay. And you can establish that, as a matter of fact, at the time of the occurrence, that person had been off the meds for maybe the last 3 weeks, Why was they off the meds? Maybe they didn't have money. Because I mentioned one of the reasons why you have most of these mental cases is because of poverty. We talk about the fact that people can naturally have these things, but then there's poverty and then there's lack of education. So and I think the host talk about, is it possible to have a monthly administration of medication? Yes, they do have that. It's called a long acting injectable, LAI. Okay, you have that for mostly for second generation, and in fact, at least two first generation antipsychotic medication. Okay, so what if the person was not med compliant? They already had a history of schizophrenia, command hallucination, not med compliant. If it's established, okay, and what if they have schizoaffective disorder? So now they just don't have schizophrenia. They also have it in conjunction with bipolar disorder. And at the time that they committed that homicide, they were in a manic and state of schizophrenia. What's the basis for um, uh, 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 coming up with the death sentence against someone who who had no control of anything at the time that they did what they did? They didn't even know that they were doing it, because I previously mentioned that sometimes you give people B52 injection, they come back to you and apologize and ask you if they were the one that even hurt you. Okay, so that would be some of the basis upon which these things, because when it comes to justice, what's central to justice is fairness. Okay, can you establish that this person actually did this, consciously did this? Okay, now if you have the data is confounded, if it can be established that the person has underlying schizoaffective disorder, was not med compliant, and there were reasons for non-med compliance, and you have enough collateral information to support that.
All righty. Thank you, Dr. Fix, on that. Favor also drop in a comment here. You can go back to your provider to address your side effect. Typical case, they will probably change your medication. So again, thank you for tuning in, everybody, on the Evelyn Marsh Network. If you do have a comment, please feel free to drop it. Again, the Favorite Grace Wellness is located in Brooklyn Center. The information is right up here for more detail. If you want to see Dr. Fix, if it's something just you just want more answers to that we are not answering or that the doctor is not elaborating on here, you can contact the number there, or you can even go on their website and reach out, make your appointment to see Dr. Fix. You will be meeting him in all the terms that were used here tonight. Most of it will be used there again, and you will break it down in a simpler term. Again, we as African, please, 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 Liberians especially, let us take advantage of these services that we are bringing out to you, including myself. I may be walking up and down here normal, but I'm going through a lot. For me, when I'm going through something, I tend to withdraw from people. I won't lie. That one, oh my, oh yeah.
Yeah,
I tend to withdraw from people for X amount of time until I figure, even though I got no control over it, I will also be seeing Dr. Fix. So not everything means up there is not. There are some things that you just need to talk to someone, and if that's something you can get medication for, you get that medication. Let us take advantage of this educational topic in our African setting, please. Yeah, sorry. It's very important, to be honest. You see, everybody. I mean, I work at a mental health the substance abuse clinic as well. You will see these people going in for these issues. But when you come to your friend, you just having a conversation with your friend, you know something not right up there, and then they're dealing with something. Or let them go get it help. They will tell you, say, picking you and get it.
Yeah, they'll say you don't want to have it. They
You
don't
don't
have
want to get it.
it.
And the blame game battle back and forth will be going on. But it's just, it starts off very small and it escalates. But the doctors are here, they're educating us. Let us take advantage of their services. This is being aired on YouTube, LinkedIn, TikTok, Instagram. It is everywhere. If you come across the video, please feel free to just go through the comment section and just grab those information and contact these professionals. They will help you. Liberia will also be airing it. The doctor dropped a lot of terms because everybody out there, once you see an area, you go Liberia, you get that people say doctor said they will accept it there. And you know you go to doctor school, the doctor, you plenty term. I would even did a CNA school. I don't know half of the term. I would take medical terminologies
The
when it's term.
CEO start learning. They talking about you. They
Yes,
Oh,
exactly.
God.
The whole BSN person, RN, she learning.
we all learning.
Yeah.
So we who in Africa are baking you. Don't come from CNA school here, then you go there, you tell the people, say you're a nurse, and you just start giving any kind of medication or treating people anyhow. The doctor use a lot of medication terms here, a lot of medical terms, and a lot of medication that he dropped. Not everything means we are crazy.
Mhm.
We just need to seek help at baking you. Yeah, please take
Yeah.
advantage of this. This is very, very important. We want to say thank you for everyone that tuned in today. We have a lot of people that tune in. I have your list, your names here. If you did not make comment, I mean, I try to pick most of us up, but if you did not make comment, I did not pick you up. We had at least 20 guests today that was watching just from the Facebook alone, not on the YouTube. But please, please, thank you again for tuning in. This will also be aired starting tomorrow in Liberia from Monday through Saturday. Let us take advantage of all this educational topic that we are bringing out. The host,
Somebody just joined. I think. I
welcome, Cherry. Welcome, Cherry. She said, "Favor Grace, you are looking beautiful." Okay,
Thank you, mommy.
don't,
CEO.
okay, so all good things and bad things must come to an end. But today, again, a wonderful. I think I saw a couple of comments. Great show tonight again,
Yeah,
and we are grateful to God. So on this note. I don't know. I think this is the first time we have gone way.
yeah, we pass.
Yeah. So I would just give the both of you the opportunity to give your parting statement and then we're gonna close. But thanks to everyone. I'm gonna start with Favor Grace. Please give your parting statement and then the talk.
Yeah, I want to say thank you for inviting me on your show tonight. It's a pleasure being here. In my advice to all those that are watching and those that will watch and listen, take your mental health seriously. Seek help when needed. Seek help is not a crime to be mentally stable. Thank you.
Oh yeah, so I want to join Favor Grace to say it was a pleasure coming on the program this evening. And in fact, a number of my patients are actually Africans, and it's a pleasure to serve uh, my people. I have other patients besides Africans, but I mean, it is always good that you can be of help to your own people. It is my hope that Liberia gets to the point where this realization of some of the mental health challenges, especially for substance abuse and the withdrawal that I talked about. For those who have listened and think that they may have some concerns, I encourage you to reach out to the Favor Grace Wellness Clinic and we can discuss these concerns. It may be something as simple as sleep. Well, it's supposed to be simple, but it is not. Because without the REM sleep, you have difficulties, and there's risk factor for psychosis, depression, anxiety, and all of these other things that follow. It can be as simple as sleep, it can be as simple as depression, and then it gets higher, especially for those who have kids uh, who have something called oppositional defiance disorder. In other words, they're just there saying no to everything and wanting to break and destroy stuff. So there's a lot of concerns that people take for granted. Perhaps maybe you can reach out, visit the Favor Grace Wellness Clinic. We can have a discussion. If there are concerns and the need for it to be further addressed, I will be sincere and let you know that it needs to be addressed. If not, I'll let you know. But it's a pleasure once more to serve my community and the greater uh, Minnesota population. Thank you again.
Canada.
Oh man, I think I finished saying what I wanted to say. But thank you all again for tuning in to the Evelyn Marsh Network. Again, you can catch us live every Sunday at 7 p.m. where we bring you this hot and juicy topic, educational topic. Again, we are on YouTube. Please subscribe to the channel on YouTube. We are on Facebook. You can like our page, follow it, Instagram, TikTok, and every platform. We are on there. Um, what the other one? Snapchat. We are all on there. Also, this will also be aired in Liberia, Magibi area. And other places in Liberia. It will be aired Monday through Saturday, and where we come on live here for a very brand new topic again for Sunday. So please take advantage of all these educational topics that we are bringing out to you. It is to help ourselves and also help you out there. Thank you again for tuning in.
Yeah, as she mentioned, we're going to be airing on the Success FM TV Monday to Friday, Saturday rather, from 9:30 p.m. to 10:30 p.m. Again, Dr. Fix, Favor Grace, yeah, thanks for being here. What an awesome night. Please come back. We want to reach out. We have to come back because we have to talk more about the kids. I mean, you can see how interesting it is until we are here way past the time. So people really want to know more about this. But my appeal to us is not every little thing that you are crazy. Okay. Just go. Probably you may just need to talk and they will tell you what to do. So please take advantage of all of these great information we are bringing your way. Again, thank you. What an awesome night. What a wonderful night. I come and see you for sleeping. I can see in a apple. So thank you, and God bless. And on this note, we have come to the end of our discussion. And like we always say here, we love you and we love you by force. This is a Basil song that was written by Pastor David Young. I've gotten a lot of requests for this song. That's the reason why we always play it. And they say, Nipo ni Yahweh, right? Yeah. Nipo ni Yahweh. What is it? God in heaven, our God, our Father.
Yeah.
So we want to leave you with this. The song we played before, it was with our brother that was on last Sunday, Will Davis, with his newer release. So bye. God bless you. We love you and we love you by force.